Hi, this is Patty and Rada with HIMSS. I'm with Amaresh Tripathi, Global Analytics Leader at Genpact. Welcome, Amaresh.
Great to be here, Patty. Thank you.
Great. Today we're going to talk about consumerism and patient experience, innovation, and data analytics. So my first question is, consumerism is playing a big role in shaping every industry, and retail, and in particular e-commerce, are being the models for change. So what can consumer marketing bring to healthcare?
Yeah, I mean a lot, Patty, and you see it across industries, and we see it with our clients all the time. So, for instance, uh, the work that we do for our retail and our banking clients, right? Whether it's like when they are trying to send them offers, for instance, right? Which credit card offers to get? What's the next best action that a call center agent needs to make when someone makes an inbound call, or what is the next product of, like if you go to Amazon, you say, okay, what will like customers like this, buy that, and that same set of philosophies and ideas and technologies is relevant for healthcare, right? Whether care managers knowing what is the next intervention they need to go and have with their patients, or thinking about what is the right way to nudge a person to take medication, I mean, medical adherence. And that some of the same set of marketing, behavioral economics, and technologies kind of come into play, which has been, I think, for 20, 30 years has been very, very common in banking and consumer industries and retail, which we are seeing the emergence of in healthcare. So as Genpact, we are actually trying to bring ideas from one industry to the other all the time.
Great. So digital and data disruption are rapidly accelerating in every industry. So why is healthcare taking a slower approach? And how do we bring it right into the digital age?
Yes, very different industries have a different flow, right? I mean, there are different stages of evolution. Healthcare has been a little bit of a laggard in terms of when it comes to digitization. So getting rid of paper, and so that we start doing all the work on computer, and there's a workflow that actually managed, which I think ERPs and others in different industries kind of happened probably a decade or so earlier. But the inflection point is now, once you have the digital workflow, now it is about how do I make that workflow smarter? How do I make sure the people who are using the workflow get more out of it? So one is we are at kind of that cusp of that inflection point. That's number one. And a lot of our clients' discussions around setting up analytics center of excellences, setting up kind of data hubs, like moving to the cloud and kind of creating all of that discussions that are happening that kind of point towards that. Second is there's a very interesting phenomena, which is obviously it's one thing to kind of change the behavior of a sales manager or of a call center agent. It's a completely different to kind of go and ask a physician, a healthcare professional, to change the behavior around how they actually interact with patients by providing better data. You are dealing with an expert. And when you're dealing with an expert, how you actually drive, it's not that it's always right or wrong, but how do you actually design such programs and make sure that it's not against like, oh, this is a machine is saying that, and your expertise is not machine versus experts, it's machine and experts. And how do you actually make that very real? There's a nuance in the change management of some of those things, which we see all the time. So that's kind of the second piece of it. And the third is just the talent. It's not an area where a lot of the organizations have invested in. Most hospital systems, a lot of the payers till very recently did not have a chief analytics officer. The CIO role was not very strengthened. And as we see more progress there, we are dealing, as I said, we are dealing with so many chief analytics officers in hospital systems and payers and for life sciences companies. So they are driving a different kind of a talent from different, which are coming from outside the industry also. That I think we are going to see a lot of change very, very soon in this space.
Great. So the Internet of Things means that people are sharing more data about themselves online than ever before. So how can healthcare leverage all this insight, and what should they be mindful of in managing the data?
Yeah, there's a promise and there's a danger, right? The promise obviously is there's a lot of data, which means there are more signals, even though the challenge is going to be how do I kind of find the needle in the haystack? So that's always going to be, it's a little bit of a technical challenge aspect of it. And the second is obviously the risk part of it is all of this data, there are biases in the data, right? Because there are not everyone can go to internet and at the same proportion and share data about themselves. Not everyone can buy an Apple Watch or a Fitbit and share that information. So there's a general inequity and bias already built in the moment you start using some of the data, which you have to be very mindful about. But the main thing is all of this stuff will be there, but how do you actually drive value, right? Fundamentally, which we have to create it at a patient at the center of it, or a consumer at the center of it. What value do they get? Do they get better information? They can manage their health better. Can a payer use this information to drive and nudge the right behaviors in their members? As long as you kind of keep it to the value and to the value of like what the consumer or the member or the payer or the patient gets from it, I think we will get more useful use cases. And you have to, obviously the technology is there. You have to be careful about some of the biases and how you deal with that. But most of it, you have to keep it centered around the value of the consumer itself.
Great. And so our last question is, the future of disruption. So what does 2030 look like for healthcare?
Hopefully a lot better than 2020 or 2021 as we are dealing with a healthcare crisis in a lot of ways. But there are two or three things which we know it'll look a lot like that. One is I think it'll be a lot more data driven, and we see it with all the investments. The entire healthcare ecosystem is making on data and digital. We know we are going towards a world where machines are trying to drive things that they do better, and human expertise and judgment is driven by the experts. And then finally, all of that thing, eventually what moves the needle is, are people staying healthier? They have a longer lifespans and more productive lifestyle, which leads to bigger GDP and other things. So that's kind of where what the healthcare of 2030 is going to look like. It won't solve. I'm pretty sure we wouldn't have tackled all the challenges, but we would have been in a much better place than what we are today right now.
Great, terrific. Thank you, Amaresh, for being with us today.
Thank you so much, Patty.